Hey everyone, this is Jason from Intricate Art Spine and Body Solutions. You can check us out at intricateartseminars.com. If you want to find more research about similar topics like what we're going to talk about today, you can check out our blog section on our website, and you can check us out on social media as well. So plantar fasciitis, right? So plantar fasciitis is one of the most problematic chronic conditions that a lot of people all over the planet suffer from all the time, right? And it's a really, really difficult thing to actually fix, right? It can be relatively easy to treat and put a Band-Aid on it, right? You know, temporarily resolve the problems. But a lot of the time with plantar fasciitis, the problem just keeps coming back over and over and over and over again, right? So one of the major problems with treating plantar fasciitis without the use of dry needling is that the tibialis posterior, which is the most common muscle that causes plantar fasciitis, is also the deepest muscle in the back of the leg, and it's the deepest tendon attachment in the bottom of the foot, right? So it's impossible to directly treat, and that makes a big difference when you're dealing with fully resolving any condition, right? The more direct the treatment, typically the better, especially when the muscles are really deep in the body, like the tibialis posterior. So just the way that the tibialis posterior is anatomically oriented, right, it makes the arch of our foot, right? So if you have the arch of your foot here and you cut the tibialis posterior tendon, right, everybody's arch would be flat. If you make the tibialis posterior tendon and muscle tight and shorter, right, it raises, it elevates your arch up more. So at that point, you're stepping down from a higher starting point, right? So you're getting more force, right? You're getting more momentum. You're putting more stress on your plantar fascia and all the internal intrinsics of your foot, right? So the easiest way to immediately address a lot of foot problems, including plantar fasciitis, is to loosen up the tibialis posterior, right? So again, this is almost impossible to do unless you have needles, because you can't directly treat the muscle. One of the other things that dry needling allows you to do with a lot of chronic conditions is treat the actual inflammation of the periosteum, right? So the periosteitis. So one of the most problematic aspects of all chronic conditions in physical therapy land, at least, is the inflammation of the periosteum, right? So if you get tight tendons and tight muscles, those tendons attach to the periosteum. It's a vascular bone lining, right? So if the periosteum gets inflamed, it's almost impossible to get rid of it unless you can directly treat it, right? So again, without needles, it's impossible to treat periosteum anywhere in the body, especially if it's really, really deep like it is in the bottom of the foot, right? So if you can use needles with the implementation of needling into your treatment, you can directly treat the inflamed periosteum, right? So really healthy periosteum feels nice and hard like a steel plate. The more inflamed it gets, the mushier it feels, right? So if you can find the mushy periosteum and treat it with needles, over time you'll feel it get harder and harder until it feels normal, right? So regardless of the initial cause of the plantar fasciitis, what causes the recurrence a lot of the time is the remaining inflammation of the periosteum that never gets fully resolved. With needles, you can fully resolve the inflammation of the periosteum, right? So it's super duper important. One of the other things that inflamed periosteum does is it dysregulates the autonomic nervous system, right? So whether they're conscious or subconscious signals, the more inflamed periosteum you have, the more negative afferents you have going up to your brain that are going to disrupt the homeostasis of the autonomic nervous system, right? So needling is an excellent way to get rid of periosteitis, right? Inflammation of the periosteum, and it's also the best way that I think exists on the planet to regulate the autonomic nervous system towards homeostasis, which is going to help all medical impairments, including plantar fasciitis, right? So if you're a practitioner who's looking for some new ways to treat plantar fasciitis and other chronic conditions, or if you're somebody with plantar fasciitis, you can get a hold of us. We can help you find a practitioner that we've trained, or help you sign up for a class. Again, our website is intricateartseminars.com, and you can get a hold of me at jason@intricateartseminars.com. Thanks.